Okay. It looks like I'm dealing with a very well-educated group of people here who have probably already figured out how to do most of what I'm going to talk to you about. You have to take charge of your healthcare nowadays. 20 years ago, healthcare was much simpler, much easier to do, and you didn't have to be as well educated in order to get good healthcare for the time. Nowadays, I would say you really need to take charge, and if you depend upon a single individual to help you get through everything, things will get missed. We have an electronic health record, wonderful thing, but they are so complicated that if the person is not overlooking what's going on, things still get missed. So that's with the current electronic health records. Not all doctors have it, about 50% of physicians have it. You have to be an informed health consumer, we said that. You need to establish a relationship with your providers. So be it a physician, nurse practitioner, specialist, you need to know them and you need to let them know who you are. Seek help when you need it. So don't wait until something's been going on for 6 months or 12 months. I'm also not saying don't call the next day when you've had this cough and runny nose. I don't really think that's going to help either, but don't ignore things waiting for them to go away when you know it's something that needs attention. All right, so what kills us? What causes humans to die? I put these in order of things that you can do or things that can be prevented. So lifestyle activities that cost you years on this earth. And of course, the number one everybody knows is smoking. Responsible for nearly 500,000 deaths per year here in the United States. So if we could get rid of all smoking, we could save 500,000 lives per year. Blood pressure, controlling blood pressure or having uncontrolled blood pressure would be the next one. So if you do have high blood pressure, get it under control. I see some people who are my age, and we can recall when stroke used to be like the number 3 killer in the United States, and it has dropped down a lot, mostly because of control of high blood pressure. Overweight, obesity, again, weight has a negative impact. Now, I take issue with this a little bit because when you look at the data on weight, if you look at heavy people who maintain activity, they're busy, they're walking, they're exercising, not that much of a factor. The big problem is people who are overweight and obese tend not to move or to exercise. So those who exercise, it isn't as big as a factor. There was just a published article this week that says even if you do, it does cost you a little bit of time and illness. Inadequate physical activity. This is one of the things that I really try to push in my practice. Getting people to lose weight is next to impossible. It's easier to get people off of drugs than it is off of alcohol, than it is off of food. So food is the hardest thing to control. But people do exercise if you encourage them to do that. And how many people in here exercise fairly regularly? Okay, that is amazing. You do better than the younger generation that seems to be too busy to exercise. Now, why do you all exercise? Why do you get out and move? Okay, to make it, to try to burn up the calories. I'll bet there's another reason, though. You feel better. You really, really do feel. Is there anybody that disagrees with that? I don't think anybody does it just to kill time, so it's usually not that much fun. But it certainly does help just about everything, and that is coming across in all of our journal articles. Everything I read anymore is the value of activity. So if you're not, I would challenge you, and I did this myself probably 5 years ago. I said, well, I need to get active, so I started walking, and I walk about 2 miles a day. And after 2 weeks, I wasn't about to quit. So it has worked, and it definitely helps with your frame of mind. A big one, something that's easy. High blood sugars, better control. Diabetes certainly has its toll. High cholesterol, We hear about that all the time. Just to sort of give you a reference on that, when I first started practice, I knew if somebody had a heart attack that it wasn't going to be too much longer and we were going to have another one. Now with our medications, particularly the statin drugs, and I'm not going to promote any of them specially, but we don't see the second heart attack anymore. I mean, it's amazing what has happened with that. Too much salt definitely costs some time. That's a pretty easy thing to do. Salt, enjoying the taste of salt is a learned habit. You can unlearn it if you just don't use it for a while. The omega-3, which is present in fish, definitely has been associated with improved health. Unfortunately, how many know what one of the bad things it does? Increases the risk of prostate cancer for men a little bit. So there seems to be a theme about all these supplements. After a while, we find out they're really not doing what we want them to do, and they have negative consequences. So we all know vitamin C came and went. It didn't do any good. And then excessive B vitamins, they don't do any good. So you got to eat well. And I would challenge anybody to show me a supplement that really makes a difference in outcomes with proof of that. Then we've got alcohol use. I think all of us know the problems with excess. I was surprised at how low that number is, because when I see the problems that I see in my office, alcohol seems to cause a bunch of them. But it doesn't seem to impact longevity as much as the high blood sugars and even the cholesterol. Low intake of fruits and vegetables probably got to do more with the colon malignancies, low dietary polyunsaturated fatty acids, and seatbelt use, which that's one of my favorite things to use as a, okay, how dangerous is this? You know, people say, I ain't going to get that flu vaccine because I could get Guillain-Barré from that. And I go, well, did you drive into my office here today? And they all go, well, yeah, why? I said, well, you had a 1 in 100,000 chance of dying coming from home here. Did you even think about that? So the answer is usually, well, no, I didn't. I said, well, the chance of you having a problem with this or whatever is about 1/3 that risk, or whatever it is, to try to put things in perspective. So seatbelt use definitely saves about 16,000 lives per year. That's not insignificant by any means. We all think that's a good idea, right? So just to put things in perspective, these other ideas are real good too, maybe even better. All right, so how do you find a good doctor? I'm open for answers on this one because I get asked that all the time. You know, who should I go see, or how do I find, I'm moving out of the area, how do I find a doctor? So how did you all find your doctors? They're recommendations from friends. That's what I always say is the best way to get a hold of somebody, someone who has can say, look, I've been there and they've taken good care of me. You want to make sure that they've had experience, so the internet is a really good place to get that kind of information. You can see if they've been involved in lawsuits. You can see how long they've been in practice. You can see which insurances they take. So those are things that are readily available on the internet. Obviously, when you're meeting with a doctor, you need to see what their philosophy is. Especially in geriatrics, that's probably more important. I mean, there are some doctors who believe that you should do everything possible to keep the person alive till that last beat comes out of their heart. And if that's the way you want to be treated, you need to find somebody who has those similar kind of values. And then I've had patients that if they had a hangnail and going across the street and fixing that's going to make them live 20 more years, they're not going to do that because they are done. So you need a doctor who's going to work with you for that, and you have to discuss those kind of things because they may disagree with your philosophy that, well, why would we not do CPR and put you on a ventilator? You should be comfortable when you're with your physician or your nurse practitioner. If you're not, that's a real warning sign that something isn't quite right there. Find out how their office functions. Do I call for appointments? You know, do I leave a fax? when do you, how do you get back in touch with me? And then see where the doctor or nurse practitioner practices. Where do they want you to go in the event that you need to be in the hospital, the emergency room? Communicate effectively. So communication is always it's probably the most important thing that has to happen between you and your provider. So how do you make appointments? Usually you make them when you leave. That's one way. Do they want them to be done on the internet? Do they want them to be done over the telephone? Whenever you have an appointment, bring your healthcare records. This is really critical for the first visitor. So try, if you can remember well enough to have if your memory is good enough and you won't forget things, that's fine. But I don't know too many people that are able to tell me when they had their last flu shot or they had their last EKG. Come prepared to present your story. So why are you there? What are your concerns and what do you want to achieve from that? Honesty is the only policy, so you just have to bare your soul. With HIPAA the way it is right now, I think you can be very comfortable that all of your healthcare information is very protected and no one has access to it unless you give permission. Now, I will warn you, when you sign up for a life insurance policy, that little line that you sign, that just gave them permission to get every little bit of information that the doctor has from you. So be careful when you sign those because you may not want to share all of that. Probably the most important thing is have paper and pencil or bring a friend with you. If you have a friend who can come with you to the visits, those are really helpful if there are any memory issues going on. All right, here are some fun facts, or maybe really not so fun facts. 1 in 4 U.S. respondents reported that they don't have all of their important questions answered at the end of a doctor's visit. So that's 75% do, which I was surprised. I didn't think it would be quite that high, but that means a lot don't. This is a physician from the University of Pittsburgh just stating that it makes good sense to communicate well because if you don't, the patients aren't going to come back. And this was given at one of the AMA addresses. Get the e-fax. Okay, this is probably the bane and the benefit of modern technology. How many use the internet to look up things, look up their health care? All right, so do you find what you want or does it cause you confusion? Yeah, I think most people are doing the confusion. So it's a great source because you can get very helpful information. But you have to be a little cautious because you can get a lot of misinformation. The most common thing I see, somebody comes in, they've had a little belly ache or they're tired and they've got pancreatic cancer. That's what they think. Everything comes up with pancreatic cancer. I'm nauseated, I don't feel well. That isn't what they really have, it's something else. When you're using the internet, it's best if you visit multiple different sites. So don't go to one site and take that as the gospel that this is true and accurate. Some sites are better than others. Proceed with caution. Seek specifics. So if you're looking up Crohn's disease or inflammatory bowel disease, don't look up things such as nausea or diarrhea or constipation. Try to get specific so you can get some more specific answers. The internet, you all know, is loaded with scams, so don't give out any personal information. And of course, the old saying, if it sounds too good to be true, it probably is, and that's true for the internet too. Okay, to use the internet or not, the internet may be helpful or confusing. Frequently it's both. Appropriate information on the internet, however, it's frequently difficult to distinguish useful from misleading. Don't be afraid to tell your doctor you've been on the internet. That really helps me if I know you've been there, you've seen this, and this is a question you have about it, and then I can take you a different direction if we need to go, or I can say, yes, that's a good source of information. Pearls to remember when you're using the internet. And this is something we teach in medicine. So common things happen commonly. Rare things happen rarely. Okay, we explain that to our residents and our young doctors that when you hear hoofbeats, you expect a horse to come around the corner. You don't expect a zebra. Now, the other thing that the young doctors have to remember is you don't try to describe that striped horse as a striped horse. You have to know it's a zebra and not a striped horse. So you have to know the difference when you're seeing something that's a little out of the ordinary, and you don't call it all the same thing. Create a personal health record. So this is stuff everybody should have written down, pretty accessible. Emergency and contact numbers, very important. Names and addresses, health insurance. Try to keep that current. From a physician's point of view, that is very frustrating when we go and, you know, they pay us gazillions of dollars now to see you, all right? And we can just send out all these requests unlimited, and it doesn't hurt our bottom line, but it does. So when we send information to the wrong insurance company, it really complicates our office a lot. So when you do get a different card, make sure that your doctor has it. It'll save them a lot of trouble about denials, and it makes things go much faster with your refills and prescriptions and referrals. We need to know your medications, the dosages. When I'm told that it's this little white pill that I take for my heart, that really doesn't help very much. So have the names written down, and the milligrams are things that are essential. Allergies, we always want to know allergies so we don't hurt you. There are a lot of cross-reactivities of medications. Food allergies included, especially things like peanuts, we need to know about that. There are some medicines. We used to give, testosterone used to be in peanut oil. Well, they just changed that not too long ago because there are enough peanut allergies out there, and that would not be a good idea to get a shot of testosterone for your libido and then end up having trouble breathing afterwards. All right, a list of significant illnesses and surgeries. Dates and years are helpful as far as what has been done in the past. Results from recent doctor visits, so if you've had those, laboratory tests, x-ray results, those are good, and then immunizations. Know your health insurance, what's covered. What is your deductible? What facilities can you use? It's very easy for me to say you need this MRI done. I can get you over at this facility tomorrow. Fine, do it. Well, then you get the scan done and they're not on your insurance. So you have to know what facilities you can use. Carry your card with you. That usually has the information that the providers need in order to get you to the right place. And you don't want to get to the wrong place. That gets to be expensive and it's hard to backpedal. Report changes in your insurance. We talked about that a little bit. All right. Anybody in here been in the hospital within the last couple of years? What is the most dangerous place in this county? It probably is the hospital when you look at the square area. So I encourage my people, and this is hard, if you're in the hospital, have somebody with you all the time. So call in the favors, your friends, your families, relatives, whoever you can. If somebody can be there every second of the day, you can't believe the difference that makes. They will see that people are washing their hands. So doctors were probably the biggest offenders. The nurses do a better job than the doctors do when you look at who is good at that. The risk of infections that you get from other people touching you, being in the hospital, is substantial. We try hard to prevent that, and good hand washing does help prevent that. Make sure that your doctor is communicating, your physician, your doctor, who you believe is managing your care, needs to be in communication with those people who are taking care of you while you're in the hospital. I don't do hospital care. I see my patients in the hospital, but I am not writing orders, because for me to get a simple CBC done would probably take 30 minutes for me to get it done right, and it might be done wrong even after I get through with the paperwork. So I do depend on the intensivists and the hospitalists to give the care, but I do need for them to bounce things off me. because I've known the patient for a long time, and your doctor probably wants to know that information. So make sure that they know who your doctor is and how to get a hold of them to get information back to them about your care. Make sure the environment looks clean. If it doesn't, that's a really bad sign. So any facility should look very clean to you. If it doesn't, that's dangerous. Everybody washes their hands. Every encounter, no exceptions. For surgery, make sure the correct side is identified. Don't be afraid to ask questions. You all know the most silly question is the one that doesn't get asked. So make sure that you ask questions. Anyhow, lack of communication is the root cause for 50% of all hospital mistakes. So communication is the best way to protect yourself from an injury. Fact about healthcare visits. I always like this. So average physician office visit, 18 minutes. Most patients will want to bring up between 3 and 6 concerns per visit. And I don't know how you all feel about that, but usually it takes more than 2 minutes to answer one of my concerns. But that's cramming a lot into a short period of time. The patients forget about half the information that is given to them on any one visit. So take notes when you're there, write it down. You only have 23 seconds in that room when I say, hi, how are you doing today? Before I'm going to interrupt you and ask you a question about what you thought you were going to tell me about. So you need to have your story ready. What do you want to talk about? Prioritize things. The United States has about a $14,000 primary care physician shortage. I don't see that getting any better. Nurse practitioners do a wonderful job. As long as you have someone who works well with their physician and knows their balance, knows their limitations. I do use nurse practitioners, and I tell you, I would trust them completely. I think they listen better than I do, not uncommonly. Okay, no more than 5 items. If you've got more than 5, you're going to have to make sure that whoever is scheduling knows that you're going to need more time. And don't be afraid to come back later. Getting the most out of your visit. Prepare a list. Okay, lists. I used to hate lists because that meant, oh, this is not going to be a simple visit. Now I love lists. My patients have gotten older right along with me. So when they were young, we only had 1 or 2 problems. And now we've got 4, 5, or 6 problems. So have your list and stick with the plan when we get there. And I'll mention that again. Take the concerns with you. Take your list with you. It's not I left my list at home. No, that doesn't work very well. Take your medicine list that has the milligrams and everything on it, or bring the bottles in with you. That's very helpful, especially for first visits, so we know what medications you're on. Ask questions until you understand what's going on. Sometimes it's pretty simple. Sometimes it gets pretty important. If that doctor thinks that you need a knee replaced, or you're going to need a pretty extensive investigation, keep asking why. What do we need to do? Why are we worried about that? It's okay until you understand. And most things in medicine can be drilled down to a fairly understandable thing. If there's something that's too hard to understand, it isn't being explained right to you. Consider giving a copy of the list to the doctor's receptionist. She may be able to expedite and get some things done, like you need a refill on this, and that can all be taken care of, so your doctor doesn't have to sit there writing out the prescriptions. He or she could be talking to you instead of writing papers. Stick to the plan. So don't get sidelined and go somewhere else, go down a different thing, because you're going to forget about the important things, and take notes. How to create the list. Don't wait till the morning before your visit. Organize, include everything that you feel it's important, and then start crossing out when you realize you're not going to be able to get all that done, and prioritize. Remembering what the doctor said. How many of your physicians or caretakers would be upset if you brought a tape recorder with you? Not a good idea on the first visit. That's going to make me really nervous. But afterwards, one of my more intelligent patients records every visit with me, and he says, I go home and I listen to it, and he says, it helps so much. So It was a little intimidating at first, but now I'm going, okay, that's fine. That's a good thing. So it's all right to take a tape recorder. You have to ask permission to use it, but the answer should be yes. Taking a friend, always a good idea if you've got somebody that can go with you. And if you have questions, there are so many materials out there. Your doctor probably has a file cabinet, no, maybe 2 file cabinets full of patient education. Okay, getting past the front office, that's got to be the hardest part. All right, so this seems to work at my office, so be empathetic. Say, I know you've been busy all day, but can you just get this thing answered for me? Be persistent, so if you don't get through the first time, go ahead and call back. The squeaky wheel, as much as we don't like those squeaky wheels in our office, they do get their answers faster than if somebody just asks one time and it gets delayed. So be persistent, be succinct. Say, I don't feel good, can I talk with the doctor? That's going to be a difficult one. So it's, I'm not feeling well, I've got a fever, I want to know, should I be seen? Well, that one's not even going to come back to the doctor. They're going to say, yes, you need seen. So you may not need to do that, but if they know what your question is succinctly, you may be able to get an answer. And if you get to know the office staff, that just is so helpful, because they're going to really know that they really liked Miss Carolyn, and we're going to get her in or whatever. So get to know the staff. It's helpful. All right, here's a big area. When do you get a second opinion? All right, you don't always need a second opinion, but sometimes you do. So how do you know when you're going down this road and, gee, maybe we better take another look, or things aren't going right. I don't want to hurt my doctor's feelings, but gee, what should I do here? Okay, if your treatment is taken an unusually long period of time. So you've had this cough for 2 months now. Okay, that's not right. And things just aren't going as you would expect. So if it takes a long time, if it's been more visits than you'd expected, you had this procedure and now you're there for your 6th or 7th visit and things still aren't getting better, or maybe even the 2nd or 3rd visit if it's something that should have been 1, 2, 3, or if it starts getting a lot more expensive. It's very reasonable to ask for a second opinion. The doctor may have an explanation that may solve that or make you comfortable with why this is taking so long, but don't, it may be time to get a second opinion. If your provider appears stumped or frustrated with the case or the way you're feeling towards them, it's not uncommon that I'll tell somebody, look, I don't know what's wrong with you. I usually will say, it's not quite time for the autopsy yet. So here's what I want to do. Let's watch it a little while longer. Time is sometimes the best diagnostic test we have. So give it a little time to evolve. Now, if something's been going on for 6 months, we shouldn't be waiting anymore. We've had enough time for it to evolve. If it's been going on for 3 or 4 days, I don't think I want to do an appendectomy because you've got a bellyache that's been going on for 2 or 3 days. On the other hand, if it has them confused, you've had 3 or 4 visits, you're not making any progress, it's time to have somebody else think through it or ask for a specialist to take a look at things. If the information you found from other sources doesn't correlate, so now you've been on the internet and they says, that bald spot on my head, it shouldn't have gotten any worse, and now we've got 4 or 5 of them, okay? All right, that's not the way it's been supposed to go, or now all of a sudden I've got the bruises, or things aren't going the way they're supposed to go. So if you've got information that says this is not how this disease is supposed to present or match, I will tell you the one thing in medicine that has worked well for me is everything has to fit. So after you've done talking, after you've gotten the history, the symptoms, the physical, everything should fit together pretty nicely. If it doesn't, the chances of you being wrong are substantial. So you need to start asking again. 90% of what I do, and not just me, I'm talking as a physician, 90% of what your physician does is based on what you tell them. Okay.